Hey there, get in your safe spaces. It's time for Everything is Traumatic. This week we are joined with a very special guest, Sandy Pickles, my partner, comedian. She's going to share her experiences with group therapy. So is Jeff. We talk a little bit about mental illness in the beginning here, but the most of it's about group therapy and how we all just need to put our shit aside and be better humans. So strap in, sit back, relax, and get traumatized with episode number 53 of Everything is Traumatic.
Hi, I'm Jeff, and I'm a therapist.
And I'm Tyler, and I'm a patient.
We're going to talk about trauma, healing, and everything. Everything is traumatic. A very rigid thought process that comes from years and years of learning. Mm-hmm. And so it's very difficult to totally get rid of it. Like,
tell me about it.
I'm an anxious person. I'm always going to be an anxious person. We can't totally get rid of that because it's part of my personality.
Yeah.
But we can work on things. So people with personality disorders can get better in certain ways. But most of the time they don't go for treatment because they don't think there's anything wrong with them.
Right.
So they might treat for depression or something underlying, but they're not going to go in and say, I have a personality disorder. I don't want to have a personality disorder. So I have lots of personality disorder clients that I feel like are getting better. But they're probably still going to have their system of dealing with the world in a certain way.
Yeah.
It's just healthier.
Sorry, she's looking at. See, she is looking at me super wide-eyed while you're saying all this.
The cat is?
No, Sandy. Sandy is, and like just saying it out loud, I feel like I have a personality disorder.
I don't think you do.
You don't think so?
I mean, so it's the other thing is like, so we all, like I said, we all have ways of dealing with the world. Like if you're taking the Myers-Briggs, we have these personality traits and levels of comfort that we deal with the world. I mean, I don't live with you, Tyler, but I've interacted with you quite a bit, and you're a little too kind and giving that I think that for you to have I mean, you seem like a person that has insight, and I think that's one of the things that personality disorder people struggle with is insight, because they come in and they do the same things over and over again. They're like, why can I not be successful? Why can I not have a healthy relationship? And it's because they're stuck in a pattern of stuff. So we all have, and if you read through the personality disorders, we all have traits of personality disorders.
Yeah, I think I took that Brix-Meyer test once. Is it Brix-Meyer? Is it who is it?
Myers-Briggs.
Myers-Briggs.
Oh, sorry, I said it backwards. What's wrong with Briggs-Meyer?
Yeah.
If this was a doctor's office and I was calling him out, it would have been just fine.
Well, you probably would have violated HIPAA by using his last name.
No, like calling him to come back for an appointment. Like in this scenario, I'm a nurse. I would say Briggs-Myers. Briggs-Myers. The doctor's ready to see you now. I wouldn't say Mr. Briggs. I guess I could say Mr.
I mean,
Briggs.
I feel like you have a little bit of sociopath in you.
Oh, okay. Well, that's good.
No, I'm kidding. No. No. So
I mean, we kind of all do.
I've got some really sweet borderline people that I work with that are very, very kind, and they have insight, and they have really messed up relationships, but they're very kind and sweet and wonderful people.
Well, I mean, Sandy, have you been diagnosed with?
There's really nothing I haven't been diagnosed with, and that's like the problem with the DSM-5 is like there's so many of these disorders that like they have such overlapping symptoms, and like it presents in such similar ways. But like I do remember when I got my borderline diagnosis was like after I had worked at the hospital, and like the psych hospital. And the thing about borderline personality is it often, and this works in either way, like either way you word it, but borderline personality is often misdiagnosed as bipolar, and bipolar is often misdiagnosed as borderline personality because they're both polar. They're both polar disorders. So like you have these like intense emotions that, you know, people, for a while I was diagnosed bipolar because I have these really, really, really happy moments. And if I wasn't really, really, really happy, I was usually really, really, really low. But like, it's the same thing with borderline is like everything is felt so intensely, and bipolar, everything is felt so intensely. But like, I had only experienced one type of borderline personality disorder. And like the girls that I served at the hospital, like were attention seeking. They, which usually came with like some kind of like hypochondria, which like they probably didn't even like necessarily believe, but like they wanted other people to believe, like obviously self-harm and like eating disorders and black and white thinking, and like all of that is borderline personality. So like, but I had only seen like, in my opinion, what would be like the worst of the worst cases. And so when I got that diagnosis, it was like, it felt like a death sentence for like 5 minutes, because I was just like, oh my God, I'm just like them. I've lied to myself in thinking that I knew better, or that like I had any insight, or that I was actually kind, and I've just been manipulating people this entire time.
Yeah, I think that's the problem. When I went to school 30 years ago, borderline was like you didn't want a borderline.
Yeah, it was
And
like
it was
worst.
it was almost like a curse word.
Yeah.
And that was a bad training, because all borderline really is somebody that usually has had some kind of erratic childhood, possibly some abuse history, possibly some kind of trauma history, and has learned that you can't trust people, and so it's hard to have relationships, and there is some emotional kind of thing. But that's really all it is. And so the people that I have dealt with that are borderline, I've had one that was really, really like classic crazy borderline, like dangerous, like stocky kind of thing. But everybody else I've had that's borderline or borderline-ish has been awesome. They have insight, they're wonderful people, they have care for others. It's just that they have been taught the world is a very dangerous place and you can't trust anybody. And so there's fears of abandonment and stuff like that. But
this all just sounds like me. But
it's the way that it, like, yes, there are similarities. Like, yes, you can say a lot of those things about you, but like, I think that there's some like clear differences. And I think that yours more clearly falls under like CPTSD.
Yeah.
And like, I think there's things that you like, yes, you share an abundant amount of those symptoms, but like, I just think that there's distinct differences. And like, I think you'd kind of have to see it to know it. Like, look at, for example, that person we mentioned earlier and you.
Yes.
Those are very different things.
Yes.
Yeah.
And like,
you have insight.
Sorry, go ahead, Jeff.
No, he has insight. You have insight, Tyler, which I think is one of the biggest thing, and empathy.
Mm-hmm.
Like, you're very caring, and like, you always like, have I pushed you too much, Jeff, to do these things, or is this okay? And so, but you know, at the end of the day, these diagnoses are so, like you said, there are so many things that are similar, and they're just a category. It is not a death sentence, and it doesn't mean anything bad. It's just they're categories for insurance companies,
right?
So that you can diagnose somebody. And I think I think almost everything. Now, bipolar can be like chemical stuff, but almost everything can be PTSD or CPTSD.
Mm-hmm.
It's got everything in it, and so it's like, I'm not going to diagnose somebody with depression, all these things, if PTSD covers it, because PTSD covers depression, anxiety, intrusive thing, all kinds of stuff. And like, Tyler, you finding your mother is like a very traumatic thing that you've been having to deal with all your life.
Yep. So, I mean, yeah, I guess if anything, it would fall under PTSD or CPP.
It's just PTSD with a C on the top.
What's the C
Yeah.
for? Cognitive?
Complex.
Complex.
So usually, like,
Yeah.
the difference being like PTSD, I mean, I could be wrong, but from what I understand, PTSD is usually related to like a single event.
Yeah.
Or potentially like two of the, or like, you know, a military experience.
Yes.
Whereas like PTSD is like a collection of traumatic events,
Yes.
usually over like a child's like entire upbringing, like from
Yeah.
birth
Yes.
to adulthood.
Yeah, it's just the greatest hits.
Yes, that's exactly what it is.
It's just the greatest hits album of mental
Yeah.
diagnosis.
I love
So
that so much.
I don't
We have the
know.
classics. Sorry.
I'm not sure they've actually made it official yet, but diagnoses are useful to a point. And so, like, diagnoses should never be your identity or feel, besides like schizophrenia, which is a hard diagnosis to accept. But I mean, everything else can be managed, and it doesn't mean you can't function. It just means you're going to have some things that get in the way, and you have to work on those. I mean, that's all of us.
Yeah.
So I tend to look at diagnosis, and people want to know, like, they come in with diagnosis, and I'm just like, do you think that's really is a good explanation of how you are? And some people like it because it helps them explain themselves, and some people, they don't. They're like, I don't think I have this, you know. And so if it works for you in a healthy way, then diagnosis is great. But if it should never work for a negative. It should never make you feel bad.
Mm-hmm.
That was like, I mean, I've been in and out of therapy since I was like 12. And I remember going back to therapy in like my early adulthood, like on my own accord, and like seeking out therapists, and like I was so focused on getting a diagnosis. It was so important to me. And like that continued for a long time of like really because I just needed a reason for it.
Yeah.
Because like I couldn't make those deductions on my own. Like my brain wasn't it just being stuck in like fight or flight mode for so long. Like it's just, you can't really have abstract thought. So I was like, just somebody tell me what's wrong with me. But
yeah,
then like,
and you're
go ahead.
sorry, in that time you're talking about, you are trying to find your identity anyway.
Yeah,
You're in the
very
like
true.
developmental phase where you're trying to figure out who you are and why you are. And so a diagnosis feels like,
That makes
okay,
sense.
that explains things.
Yeah.
And it's great as long as it doesn't make you feel like, oh, I'm broken, I can't,
Right.
I'm bad. As
Right.
long as you can basically say, you know, this helps categorize who I am, and it makes sense to me. And now I can just work on whatever I want to work on.
Yeah. And then once I got my hands on a DSM and I started reading it, I was like, oh, well, this is all just horse shit. Like, the fuck?
Yeah. Yeah.
And what exactly is a DSM?
It's the diagnostics. What does it stand for? Jim?
Diagnostic and Statistical Manual 5.
Yeah,
and
we're on the
soon
fifth
to be
one.
5R, if it's not already 5R.
But it just...
I grew up on the 3 and the 4, or maybe the 4. So it was a lot different. I liked it a lot better because of the way it categorized things. But now it's almost like you're right, just like everything's on a spectrum.
Yeah, it's just like copy and pasting the same list to every category of illness. Like,
Yeah.
so you go through and it has like bipolar 1, and like it describes the symptoms of bipolar 1, and like
Yes.
medications that are like, or chemical compounds that are like effective for this, like, and it's just a diagnostic manual. So it's like, what's wrong? And you open this book and it gives you like, but it's crazy to see how many of them are the same fucking thing with very little variation.
Yeah.
Yeah,
so-
like if you look at depression and anxiety and all these things, and PTSD and all these, and bipolar, so it'll like say you have to have 5 of the following symptoms or whatever, and then you go down and check it out. It's sort of cool in the sense of I am sort of negative about it. It is useful in the sense that everybody uses it. So if I'm calling somebody depressed, major depression, there is some understanding like, okay, so I know what that means.
Sure.
And so that's a useful piece of it. The problem is that it's just like there's a thing called the ICD-9 or 10 or whatever it is now, and it's got all the physical things that could go
It's
wrong
like your
with you.
codes. Like if you have like
Yeah.
an abscess of the left foot, it's 94.22 because it's the left foot.
They're
Yeah.
diagnostic codes.
Yeah, you use those.
Yeah. Okay,
But
interesting.
so like if you're going to the doctor for the flu, they have a code for that, and that's how they get
how they
reimbursed. And it's the same thing with psychology.
Yeah.
If you're using any kind of insurance, there has to be a diagnosis, and you have to support why you would continue seeing them. So you'd have to say, they've got major depression and they're getting a little bit better, but I need to keep seeing them because they're still not totally better, and it's like all this stuff. So I don't have to diagnose anymore, although I diagnose everybody, but it's just for fun.
I just do it for funsies. You got a terrible case of IBS.
Man, do I have IBS.
I like how, I don't know, and maybe this is going to be a really dumb conspiracy theory, but it sounds like diagnoses was just created by big insurance in order to fucking regulate how much they're actually willing to pay for something.
Yeah, mostly.
I mean, I think it definitely is. There are uses for it. So it is, again, that thing of like, okay, so most people are going to agree pretty close. You might say like, oh, it's major depression, blah, 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 to minor, major depression recurrent, or it's like dysthymia. And dysthymia is like long-term, low-grade depression. Mm-hmm. But I mean, people are going to see it the same, but it only has a certain role. We don't do any diagnosis where I work, besides just sort of talking through it.
Okay, interesting. Yeah. I mean, like you said, you do it for funsies, but you don't. That's not what you guys are about.
My brain sort of works, and it sounds like yours does a little bit too. Is when you've studied it and when you've worked in mental health, it's sort of a way that you see things. You of see things. Okay, like so this is bipolar, and so this is this, and this is this, and so it helps clarify it in your brain. But I don't look at a person based on their diagnosis. I don't care what their diagnosis is. I want to, they can get help and they can get better.
Yeah. And like you mentioned, like they are not their diagnosis. They are not their illness. Like it's just a part of you. And
like we don't we don't categorize people that have cancer as that's who they are. It's just a disease.
But do we? Because we dedicate an entire month to breast cancer.
Jesus Christ.
Yeah, but that's
to the research and the awareness of breast cancer.
We could get into
why
some
just breast cancer,
theories.
Sandy? I'm sorry.
Yeah, we could get into some conspiracy theories about all the companies that are like trying to stop these things that would go out of business if these things didn't exist, like all the things that would lose money if cancer didn't exist or breast cancer was cured or whatever. They wouldn't be able to make money anymore.
This is true.
That's pretty dark, but
no,
but it's the way our system is thought. Yeah. It's the way that the system makes you think about it. Like, okay, I have this great thing that could help people or make people feel good or make people feel a certain emotion. But how do I make money on it? And how do I make so much more money on it, but while undercutting everyone who's helping me do it, is what it feels like. So yeah, there's never going to be a cure for cancer.
There is, but access to it.
Sort of like pivoting into group work. I don't know if you're recording yet or not.
Oh, well, yeah, I have been.
Okay. Sort of pivoting into group work. One of the best things about group work is the universality of group in the sense of when you sit around with a group of people and they start talking about their feelings or what they are, they get feedback from other people that are in different parts of that. You may have somebody with depression and somebody with anxiety and somebody with bipolar and all these things, but they have commonalities. And so it's like, you talk about this stuff and it's like, oh, I don't feel so alone. There's somebody else that has experienced what I experienced. So sometimes with just therapy, you feel alone. You've got your therapist who identifies with you and affirms you, but it's really nice to have somebody say, "Oh, I know exactly what that feels like. I've struggled with that and I've gotten better," or "This is what worked for me," or something like that. And that's what I love about group work is it brings people together and lets them explore their common experience. Creates community.
Yeah. And I think for me, what was so surprising about group therapy, like I was so vehemently against it in the beginning because I was just like, I have nothing in common with these people. Like I don't know them. I don't care to know them. Like I just don't like people. I don't want to be vulnerable in front of people. But it was also like one of the first times that anyone listened to me.
Mm.
And that was so fucking powerful. Like,
Yeah.
because my upbringing wasn't like obviously abusive. It was more negligent. And so, like, that was so huge for me to like speak in a room full of people and they listen. Like, it was just unbelievable.
Yeah, I mean that's a really like very odd and like very like nerve-wracking feeling of like being listened to for the first time.
Yeah, yeah. But it was, and then it was like I couldn't get enough of it because it was just so nice to have people that were eager to like listen and talk and discuss and pick things apart and like look at it. Nobody ever wanted to look at it. So to have a room full of people that were eager to look at it, I was like, I can fuck with this. I can do something with this.
And so like, I'm sorry. Just to give the listeners who's tuning in.
Yeah. Cause we kind of jumped in the,
Well, we're going,
right in.
yeah, I'll do.
Yeah. You'll do the thing.
But I just want to like, cause I've never done group therapy and Jeff, have you done group therapy before?
Like as a patient?
So we, in grad school, we had a group that was basically group therapy in my group therapy class where we were a group and went around and talked about our stuff. So yeah, I have, and I love it. It's exactly what Sandy said. Is just like it's called universality. It's just that feeling of I'm not alone, and it's so wonderful. And group is so good for just listen. You usually like people will take turns, and we're going to do you today or whatever. But then they'll just come in, and there's this feeling of just, especially in a closed group, which is like a group that doesn't change. Mm-hmm. So it's like you just get to know the people, and you just sit there and you talk. And you would do that in the hospital or maybe outpatient or just individual kind of group stuff. It's just such a wonderful way to explore humanity, and it's the best of humanity. So like we talk about a lot of negative humanity things. Group is where people come together and support each other, and there can be problems, but generally it's a very positive experience. I've been on both sides of the group, so
that's got to be so interesting to observe as like the practitioner, like to, especially if it's not like like you said, if it's like a fixed group that is just the same people day in and day out, like to see that growth and like camaraderie happen and like those relationships develop, that's got to be such a privilege to witness that.
Oh. And I'll give you a secret. So like group for me, the best way to do group is to have two clinicians in a group. And so it's not as hard as individual therapy because once you get the group moving, basically the therapist is just there to set some rules and make sure it doesn't go off the rails. But the group runs the group. And so you're just there to support and make sure that everybody's getting what they need.
Right.
So you just get to sit back and just watch people take care of themselves. And so the other thing is it shows that you don't have to be trained to help somebody. If you just listen and you care about them, and people want to help other people, and people want to talk about how they've gotten help, what's worked for them. People love to share where they are. Yeah.
Well, I mean, I think they should.
Yeah.
Like, I think they should like people.
It should be a more regular practice amongst humans. Yeah.
If we I don't know. Like, I just feel, because I mean, it's something that does intrigue me. I'm a little nervous about it, but I don't know. Like, we kind of see that all the time with our friends, loved ones. Like, we see that group, our group, always like change, evolve, go through hard times, go through devastating losses, and go through like very high highs. And we see those people like achieve their goals and live their lives, and they have kids or whatever. And we're kind of already doing it, but like if we did it in this way with strangers, and like, I don't know, I think it would really help, because it does it, like you guys have mentioned, what is it, universality, something,
Universality.
universality, I
Yeah.
think is something I 100% agree with. Like, it helps me to not feel alone, and it helps me to identify a disease, a mental disorder, whatever. It helps to put a name to it so you know how to address it, kind of.
When you were doing that shot for shot, that was more like the comedy thing, and y'all were sitting around and talking. Not the
Yeah.
not the drinking one. That was sort of a group. I mean, y'all were sitting around talking about issues. It wasn't set up to be a psychological group. A group doesn't have to be, you just have people together and you talk. I mean, we're doing a group right now with the three of us where we're just talking about how we feel about stuff. And so it can be a friend group too, where you're just sitting around shooting shit and just talking about stuff. And then you're like, oh, I've had a rough week, and people are like, oh, what's going on? It's just people really want to, for the most part, want to help others, and give them their wisdom.
What do you think, Sandy? I feel like you gotta.
I'm just it's just taking me back to like my to group therapy and what that was like entering into it, and like the people I saw, and yeah, it's just I'm just feeling the things, smelling the things, like it, yeah, it was wild. It was a wild ride. I did intensive outpatient therapy. I had been going to a regular therapist that I saw weekly, and I just could not make improvements. I could not get anywhere with therapy. And I had seen, like, I had had a couple different therapists over like the last year, and like one I liked and then stopped taking my insurance. The other one was a fucking Boy Scout. And then like,
Wait, I'm sorry. I don't mean
not
to
like a literal Boy Scout. I don't know how to explain it.
No, okay.
He just, I felt like he had nothing to teach me.
Okay. Well, I mean,
He-
you explained it perfectly.
Yeah, he started as a drug and alcohol counselor, and I felt like most of the time we spent time talking about my marijuana use, and I was like, that's just not.
There's bigger problems.
Yeah, we can't even begin
Yeah.
to tackle that. But then like found a therapist I liked, and we were driving, and like, yeah, just every week I'd go back, and I was just sobbing and like could not. I couldn't fucking take it. So we were looking into something a little different, and I did my research and like looked at a couple different places, and then I just found this group at a local psychiatric hospital that did outpatient program. And so I started there, and like the first 2 weeks I went every day, and it was just a regular, Monday through Friday anyway. It was just a regular group therapy. And then once there became availability in the DBT group therapy, then I transitioned to that, and that was like 3 days a week. And that's actually where I met Will, was at that therapy. But yeah, we had a very eclectic group. I sat next to this girl, for the life of me, I can't remember her name, but she was a Mennonite girl. So like she came in with like the full dress and the bonnet and like the whole shebang. And we had like, there's like this African American dude in there that was probably like in his mid to late 20s, possibly early 30s. And then there was like a middle-aged man and like a middle-aged older woman that was like a mom and a grandma. And then there was like a hood rat chick that was whatever, but like I don't fucking know. And we started out with like one therapist, and then I think they would actually rotate like with 3 different therapists. in that group. I can't really remember. It's been a long, long time. But yeah, it was just wild. It was wild, especially because like going into it, I just, as much as I wanted it, I felt so closed off to the idea of like sharing myself with like a group of people when like the people that I was supposed to be able to trust my entire life were not trustworthy. So like, why the fuck would this room full of strangers be trustworthy? But I mean, not a day goes by that I don't talk to Will ever since I met him there. And I still have this like bracelet. It's like a cooling bracelet. It never gets warm. I mean, I guess if you tried to like heat it up or whatever, but it's just like a certain type of bead that stays cold. And like, because we did a lot of like crisis intervention with which dealt with like sensations and like textures and different things like that to help people like release from a moment of like really overwhelming panic or I don't know, flashbacks, shit like that. But yeah, she gave me that bracelet. I still have that. I'm still friends with one of the people on Instagram. Like, it's so wild. And we just had like such different experiences in life.
Yeah.
And it's just wild.
But we all have different experiences, but we all have experiences that we do all share, or at least like feelings,
Yeah.
emotions.
The results are similar.
Yeah. So it's like, I don't know, if we focused more on like what we have in common than what we don't have in common, we could get along a little better because we share some pretty core things.
Yeah.
You know. And I don't mean like personal beliefs, but I mean we all breathe that. I mean, hold on, Jeff, you made a post asking like what we all have in common. What kind of results did you get from that?
I mean, we all like love our pets. We all love our families. We all like have to eat and sleep, and we all like. I mean, I think we all are. We talked a little bit about this last week, the hierarchy of needs.
Yeah.
We all just want to be safe and loved, and we want the people we love to be safe, and we want to be acknowledged and affirm that we have value. I mean, these are the things that, like, I don't know. I mean, we may have talked about it, but no, we haven't met since we didn't talk after the assassination gate, right?
Oh my God, no, we have. I mean, we kind of have, but assassination gate is what we're going to call it. Okay.
Well, I don't know what we're going to call it, the ear, but I mean, the whole idea that people in the crowd, there was a doctor in the crowd who's a Trump supporter, and it's very easy for me to look at Trump supporters in a certain way, but that person in the crowd, he was a doctor, and he like did CPR and first aid on the guy, on one of the people that got shot. And like, and I don't think he would have cared who it was. People, we have these things that separate us until we have these common needs, and then people become humans sometimes. And that's not always, but it's very easy to categorize an us or them. And so that's what group I think does. Is that we're not an us or them. We're just an us. We're all going through shit. Mm-hmm. We all understand that we have our different shit, and then people want to affirm and help. And so you could have people from any religion or religious party political party in a group, and they would just talk about their common experience. There are some people that cause problems in group, but that's not usually because of those things, because you set rules and guidelines on those things. But we have more in common than we have is separate.
Right.
We just like to categorize ourselves in these ways. But so I have to work on my prejudice against people that it's very easy to say, oh, these people are a certain way. And it's just not the way it is. People are very different, and they have political or religious beliefs for a variety of different reasons.
Yes, and I think what it is the old saying of a few bad apples ruin the whole batch. It's I agree with you, like we have to keep that in mind, but there are still, on that other side, there are still people that want to harm. There are people that want to see the disenfranchised or minorities or anyone who isn't like that fits a certain narrative wants them exterminated. Like there's evil, there's bad people. We're capable of doing bad as good. And so, I mean, it goes in line with us being complicated humans. But my question is, I guess just thinking about it out loud, like, is there any group therapy resources in the region that you guys know about? And if someone was wanting to get into group therapy, how would they, I don't know, how would they get into that?
I mean, I would certainly think that, like, as far as like this area of like East Tennessee, I'm sure like Peninsula does shit like that. I think like any, like your therapist is a part of a therapy group. Like it's not like you just see like a private practice kind of
Yeah.
therapist. I would assume that therapy group probably has a group therapy program.
Yeah. So
And
just,
like the old therapist I had in Knoxville, he was in a
Yeah.
therapy group and they had like a group therapy program.
okay. So, like
So
most,
like Cherokee, Helen Ross McNabb, Peninsula, all those. One, and this is more for a more specific type, but all the AANAs, Al-Anons, all those are really, it's a type of group therapy, um, basically, and those are all free, but those are if you have specific things. But anybody can go to Al-Anon. I mean, Al-Anon is just for, it's supposed to be for people that have lived with people that have alcohol and drug use disorders, but I mean, anybody can go to those. And they have some interesting kind of things, but I think the core of what works is that you have people sitting around talking about their common problems.
Yeah, I mean, as humans, our community is so necessary to our survival. And so I think
Yeah.
when you're like given this opportunity, like, we all have these communities like that we grow up with, like our immediate family. And then like we have friends that we make in school and like that's kind of our community. And then you have coworkers that kind of become your community. But like, you have a commonality in the things that you're learning, the work that you're practicing, your holidays spent together. But it's so unique to find a group that has such a life altering common denominator. Like, like, yeah, it's great to have coworkers that you get along with and that you feel a sense of community with, but like to deliberately go into a group of people that you don't know other than the fact that you share this challenging trait of, substance abuse, or whether it be you or your family and going to Al-Anon, or like there's groups for self-harm, there's groups for eating
Yeah.
disorders, like there's Alcoholics Anonymous has kind of created this like umbrella of, meetings for different types of addictions. And so I think it's so, I think, intimidating because it's so vulnerable. Like you can work with your coworkers for 10 years and they really won't know anything about you. They might know your coffee order or what you typically eat for lunch, but like they won't ever know that, your mother was an alcoholic, or you lived with your grandparents and they had this like drug addiction, or that you have an eating disorder. So I think it's just really wild to walk into a room and not know anything about them other than like they have a tragic history that you also share with them. And that's just a wild thing to walk
yeah.
into.
Yeah, absolutely. But doesn't it make you, does it, I don't know. I mean, based on your experience, do you feel like it's helped like ground you some and at least see that like, did it help you not feel so alone?
I I don't yeah, I would say that it did help me feel less alone in my life. I think it made me feel more safe to share things with people. It gave me practice at sharing things with people because that's not something I knew how to do. I think it made me feel like my mental illness is less of a death sentence because there are other people living amongst us with that. I think it took some of like the power away of like the ego in feeling like I'm the only one that's ever felt like this. I'm the only one that's ever dealt with anything like this. I'm the only one that's experienced this thing. And so like to know that I'm not, it's just like it made the symptoms, it made the diagnoses like less threatening.
Yeah. It kind of helped take away it helped took whatever words, take away that power that these symptoms and these,
Yeah, it's similar
what it
to
had.
like a small child. If a small child is outside playing and the child falls, if the parents, oh my God, are you okay? Are you all right? Like that child knows that something has happened, that something is wrong, and it responds accordingly. Whereas I think if, the child falls and everybody just kind of witnesses their experience, the kid's like, oh, okay, we're good. We're good.
Yeah, I don't
And it,
feel the need to cry and
yeah,
pee my pants because no one else is freaking out.
yeah. So I think it kind of gave me that was like, oh, I guess if everybody else is seeing this and hearing this and not panicking about it, then maybe I don't need to panic about it. So I think I don't know. It just, yeah, I guess it did make me feel less alone and more connected to like humanity in general and not just living in this space in my head of who I think I am.
And Jeff, what about? Oh, go ahead. I'm sorry.
I feel like you're getting it right. You're hitting on the head, Sandy. It's just, and so like, I encourage anybody that needs mental health care to get mental health care from a professional if they can. The problem is that's not always affordable. There are ways to do that, but just, we're having a group right now. You can get a group of your friends together and just talk about what's going on. You don't have to have, again, I totally support professional mental health care, but you can also just talk to your friends and family. And that's why we ask always as therapists, do you have a support system? Because that support system is key. And so, I mean, the three of us could say, we're going to have a group every week and invite whoever wants to come and we can just sit around and talk. And you don't have to have a therapist there to make it work. You can just talk things through. So it's a wonderful, I don't know. It's just a wonderful thing. And it feels great to be affirmed. It feels great to be understood.
Yeah. And guys, I kind of think this has reached its logical conclusion on that note. Do you
And
guys...
I'd love to, I mean, I know we've talked a little bit about it, but I'd love for three of us to hang out.
Oh, yeah. We do need to hang out. Yeah.
Yes.
Because Sandy seems like pretty awesome from what I can tell. Talking to her a couple of times. But I mean, and with this podcast, we're trying to do, it's not a group because it's not interactive with everybody, but we're trying to demystify mental health for you. And it's not magic. It's just about listening and understanding and talking and being vulnerable and allowing yourself to talk about what's going on.
Yeah. Yeah.
Yeah. And allow yourself to be honest with yourself and be truthful. And like, I will be the first to tell you that I struggle very deeply with that. I'm very flippant. I feel like I change my mind a lot. I'm like, at first that didn't bother me. And then it's like, no, that really did fucking bother me. I'm a people pleaser. I want everyone to be happy. I want everyone to like me, and I don't want to be kicked out of the tribe. That's why we start our own tribe. But Sandy, thank you for being on the podcast and sharing your experiences with mental health issues and doing group therapy. Jeff, thank you as always for being here. And thank you, listeners, for listening to the podcast. If you want to communicate with us in any way, send us an email at everythingistraumatic@gmail.com. We don't have a fucking email. Vin hates us. I blame both of you guys for doing that. Really rubbed him the wrong way the last time.
Cry me a fjord.
Yeah, you cry me a fjord. Thank you. Please like, share, subscribe, do whatever the fuck you want with this podcast. This has been all of us here at Everything is Traumatic. I'm Tyler.
I'm Jeff.
I'm Sandy.
And as always, the ego is not your friend, and please take care of yourself.